Thanks, Susan. Well, at this point in panel discussions, the audience is usually saying, well, everything's already been said, but it hasn't yet been said by everyone. So I'm going to try to avoid that trap, however, and just add a couple of points to what Maura and Corey have already said. I think today's discussion is very timely for a couple of reasons. One is, as most of you know, and certainly as those of you who've been following the Modernizing Foreign Assistance Network's work know, this is an important time for reconsidering how the U.S. organizes its foreign assistance. We'll undoubtedly in the discussion talk more about the efforts that are now going on in Congress to rewrite the Foreign Assistance Act of 1961 and the efforts that the Obama administration has put underway in the last year to come up with a new overall development strategy as well as the quarterly review of development that the State Department and USAID are leading. So it's timely for that reason, and it's also timely because of a lot of the work that's gone on recently at USAID and elsewhere in looking at research and development as elements of our new approach to foreign assistance. So I want to just say a couple of words about each of those. I think I'll just start from where Corey stopped by giving you a couple of other examples just quickly to help us think about how important it is to invest in research and development as part of our foreign assistance commitments. Recently, Raj Shah observed in a speech that he gave at USAID that science, technology, and innovation can help us leapfrog past development problems that can otherwise take generations to tackle. And I think he's absolutely right. I'm sure many of you would agree. But let me just give two main examples in addition to what you've already heard about cancer and the connection with the causes and consequences of infection. Let's just look at vaccines. In the lifetime of some of us here, smallpox was eradicated as a result of investments and research in a vaccine for smallpox. In fact, just think about it for a minute. That's something that affected millions, tens of millions of people over thousands of years. And as a result of research and development, that disease no longer exists. And in fact, some of you in the room are young enough that you've never known a world with smallpox. Polio in the last 20 years has declined by 99% around the world. It's well on the way to being eradicated. Measles have declined by 75% around the world, mainly in lower and middle income countries. And that's been the result of both the discovery of new vaccines that are able to be deployed widely, and also their implementation in national programs and regional programs that ensure that they get to everybody who needs them. So it's not surprising that Bill Gates has called this the decade of vaccines, because we really are in a position where with the new vaccines that have been developed to address measles, mumps, rubella, hepatitis B, human papillomavirus, that's one of the causes of cancer that Corey was talking about, rotavirus vaccines. We're really at a stage where, with the appropriate investments and with the deployment of these resources, we can really see tremendous improvements in public health in poor countries around the world. The other example is one that I thought I would just spend a minute on because several of us have just come back from the International AIDS Conference in Vienna. And HIV and AIDS is, at the time that smallpox was eradicated, AIDS didn't really exist as a public health problem. But in the 30 years or 31 years since smallpox, HIV has become arguably one of the largest and most challenging global health problems that we have. But again, through research and development in the last 15 years, we've seen tremendous advances. The introduction of highly active antiretroviral therapy in 1996 has, for those people who have access to it, turned HIV from a death sentence into a chronic illness. And now we're seeing that at the end of last year, UNAIDS reports that about 5 million people now are on treatment, and so that includes people in lower income and middle income countries. And there's still more who need treatment, but 5 million, when you consider that 10 years ago there were virtually none on treatment, is quite an accomplishment. And through continuing research with better formulations, new combinations, new therapies that have different mechanisms of action, those are the kinds of continuing research that are really making it possible to even do more with the resources that are available to help treat even more people who are living with HIV. And then at the same time, because there are still more people who are infected every year than are treated, we have to figure out a way to deal with prevention. And that was really one of the big themes of last week's meeting in Vienna, was HIV prevention. There were important studies that were supported by US government funds a couple of years ago that led to the understanding that male circumcision could be 60% effective at stopping HIV infection. So that's led over the last couple of years to major efforts to expand the use of male circumcision as a prevention tool. But last week, there was even better news on one level from the COPRISA trial, which was done in Durban, South Africa, along with partners in other parts of South Africa. And this is the first time that we've seen success for an antiretroviral used as a microbicide to prevent HIV infection. So the women involved in that, or enrolled in that trial, there were 39% fewer infections in the treatment arm than in the other arm. So that really is an important proof of concept. And I just want to observe that COPRISA is interesting not just for that reason, it's a scientific breakthrough, but also it's a trial that was done by South Africans in South African institutions. It's really a tremendous indication of what can be done through investment in research and development to build capabilities in other parts of the world to do research on the issues that really affect those populations.
Can I just add one thing on that? And I think that it's great, and USAID actually funded 90% of it. So I think it's an example of the kind of partnership that is great.
Thanks, and that's exactly the next point I was going to make. So, and it's an important one. So we'll come back to that in the discussion. All right, so those are just some examples of, in case anybody needed to be persuaded, R&D really is important for global health. And then the second point that general point I want to make, and then I'll stop, is that global health is really important for sustainable development. And here, think about the ways that the world has changed in the last 50 years since the Foreign Assistance Act was first implemented. At that time, actually, there was an interest in science and technology for development. There was actually a fairly robust academic and practitioner community worrying about this. But what they were worrying about were things like, building roads and power plants and, electrifying countries, bringing telecommunications technology, the old kind where you had wires and major investments in infrastructure. But the world has changed, and now those investments have actually paid off through economic growth and development in many ways. But now we're faced with a new set of challenges around disease, and we don't have time to go into a long discussion of this. But I think the impact of globalization, some of the challenges that we now face, are that it's ever more important to work on improving health in populations around the world because of the links between health and wealth. So that you won't get sustainable economic development if populations are so decimated by HIV and AIDS or by the new epidemic of non-communicable diseases that they can't work and can't provide for their families, and this makes it difficult for people in poor countries and even in middle-income countries to sort of climb the ladder of development and get to the point where they really do have the resources to be able to deal with these problems on their own. And so that's a reason why global health is so important a part of development. And as we've seen in the last year and some, the Obama administration has really made development a key pillar of US foreign policy. So this links in very nicely with all of that discussion. And I think there, we, through the Modernizing Foreign Assistance Network and the work that the Global Health Technologies Coalition has done as well, there's now a fairly vigorous discussion going on in town about the nature of the principles that should be exemplified by our new approach to development. And so I just want to say a word or two about that. And we've already heard from both Maura and Corey allusions to some of this. But we hope that what we'll see as this discussion goes forward and as the government, both the administration and Congress, begin to work their way through all of these issues, is that we'll see a development strategy that, as Susan outlined at the outset, is one that's whole of government, that it is coordinated, that it is coherent, the right hand knows what the left hand is doing in the broadest sense, and one that's also responsive to local needs. So we hear a lot about country ownership, and that really is the difference between flying into a country and saying, we're from the U.S. government, we're here to help, versus listening carefully, as Corey was saying about some of the work that he and his colleagues have been doing in Uganda, listening carefully to what people's needs are and the help that they feel they need, because they'll know much better than we will exactly what needs to be done. I think transparency and accountability is another critical pair of principles in this context. And also partnership of the donors, including the U.S. government, with national governments, with other aid recipients, the people who are directly affected, and with civil society organizations, both here and abroad, who really have the skills and the resources to bring to bear on this. And then finally, I wanted to just add one last point, which is that Susan mentioned earlier the notion of a whole of government approach. I think the other thing that we might want to discuss a little bit is the notion of a whole of society approach. I'll just make two final points there. One is that as important as all of the aid flows are that come through official development assistance, the work that Carol Edelman and her colleagues have been doing on the Global Index of Philanthropy and Remittances shows that official development assistance is only a very small part of the total flow of aid that comes from the U.S. to other countries around the world. And a large part of the other aid flows come from, for instance, the work that NGOs and corporations do in working in foreign assistance. And I think that if we look at this in terms of what are all of the resources and skills that the U.S. as a society has to offer, how can those be brought to bear as coherently and in as coordinated a fashion as possible to really move the needle on some of the issues in global health that we've talked about a little bit. So I'll stop there and we can open the discussion.